Welcome back to more E&I UK and Europe edition. Now for some interesting stories from around the United Kingdom this week. We welcome first today on our show, Love and Season. Thank you for joining us. You will be reporting for us more about the plan on vaccination against COVID-19 here in the UK. Is that right?
That's right, Giancarlo. Thank you. So a leading scientific advisor to the British government said Tuesday that he expects several coronavirus vaccines to have been approved by early 2021, allowing life to begin to return to normal. John Bell, professor of medicine at Oxford University, told lawmakers that Monday's announcement by U.S. pharmaceutical giant Pfizer that its vaccine candidate was effective in treating patients was likely just the start. Bell, a member of the government scientific advisory group for emergency SAGE, said the news signaled other leading potential vaccines in late-stage trials could prove similarly effective. Pfizer said Monday tests of its vaccines, developed with German partner BioNTech, involving more than 40,000 people, had been 90% effective and was a critical milestone in the bid to counter the virus. It is one of 10 in large-stage trials around the world, which have so far shown promising results. The British government has reserved 40 million doses of the drug, which Bell expects could receive regulatory approval within 3 weeks. British Prime Minister Boris Johnson gave the news a cautious welcome on Monday, noting it was still very, very early days, and vaccinating many of the UK population was still some way off. Britain has been one of the world's worst hit by the global pandemic, with more than 49,000 deaths from 1.2 million positive cases. Back to you, Giancarlo.
Thank you for that report, Lavan. But how does the British government plan to carry out such a large-scale vaccination program?
Well, Health Secretary Matt Hancock said that Britain's state-run National Health Service, or NHS, was up to the challenge of delivering any vaccine that gets approved with the help of the armed forces. The government plans to prioritize access to the drug, starting with the most vulnerable people living in care homes and, of course, the staff looking after them, which is the NHS and social care staff, and then coming down through the age ranges. So the vaccine will be delivered through care homes, GPs, and pharmacists, as well as the go-to vaccination centers set up in venues such as the sports halls. Giancarlo?
Thank you, Lavan. Yes, this vaccine really does sound promising, but are there any perceived challenges ahead with this vaccine?
Yes, there are some warnings given by a researcher at the University of Bath, Dr. Andrew Preston. And he said in an interview that the trial is with 2 doses of the vaccine 3 weeks apart. So you can imagine getting people to come back for that second dose makes it more complicated. Also, he said that its storage requires very cold temperatures, much lower than the normal domestic fridge or freezer. So in many parts of the world, that creates a real logistical difficulty that have bombarded vaccine programs for many of the existing regular vaccines. Giancarlo?
Thank you so much, Lavan, for that report. We look forward to more updates of that report.
Thank you, Giancarlo. So reporting from London, United Kingdom, I'm Love and Season, and we live in interesting times.